Stop now! Are you unknowingly making one of these 9 baking soda mistakes that trigger irreversible reactions in your body? Today we dive into the startling truth behind excessive baking soda use, revealing how it disrupts your body's delicate pH balance, sets off irreversible chemical reactions, and jeopardizes your heart, nerves, and nutrient absorption. In the next few minutes, we'll debunk misleading myths and deliver clear, evidence-based insights to empower you to make safer, smarter choices for a healthier life. Metabolic alkalosis and blood acidity changes. When baking soda intake escalates beyond what the body can handle, a condition known as metabolic alkalosis may develop. This happens when blood becomes excessively alkaline, disrupting the delicate pH balance that supports your cells and organs. Some might think that countering acidity is always positive, yet pushing your body too far in the other direction triggers adverse effects, particularly for older adults. The kidneys and lungs work tirelessly to regulate pH levels, but if you consume too much sodium bicarbonate, they might struggle to keep up. You may experience prolonged fatigue, muscle cramps, and in severe cases, confusion or dizziness because important minerals become depleted. Research indicates that dramatic pH imbalances can even affect how certain enzymes function, reducing the body's ability to break down nutrients properly. This scenario can snowball into complications, such as electrolyte imbalances and heart rhythm disturbances. If someone suggests that a high alkaline state is always beneficial, it's essential to remain cautious and seek professional advice before making drastic changes. After all, having the right amount of acidity in your system supports digestion, immune health, and countless metabolic processes. Keeping a balanced approach, rather than over-relying on baking soda, helps ensure that you stay on a steady path toward better health. Chemical reactions in the body. Baking soda interacts with acids to generate carbon dioxide, which might seem harmless when you are baking a cake. However, when you ingest large amounts daily, these chemical processes can become more complex and sometimes even irreversible. Each cell in your body relies on precise chemical pathways for energy production and nutrient utilization. Overloading sodium bicarbonate risks altering the normal interactions between enzymes, hormones, and other vital substances. Some older individuals, striving for quick solutions, fall for claims suggesting that more is better. Yet scientific observations show that once certain reactions tip out of balance, it can be extremely challenging to reset them. In particular, prolonged overconsumption can force your body to deplete essential minerals like potassium in a bid to maintain internal stability. That shortfall weakens muscle function and can aggravate existing conditions, such as kidney issues or high blood pressure. As we mentioned earlier, buffering your system too aggressively may set off a cascade of metabolic shifts that harm overall vitality. While moderation can be helpful for specific health goals, constantly pushing your body's chemistry to extremes is seldom a wise choice. Listening to reliable medical guidance and tuning into your body's signals is a safer path. Misleading information. The internet is overflowing with dramatic claims, declaring baking soda to be a cure-all for nearly every ailment. Many people are led astray by catchy headlines that overemphasize its potential benefits while downplaying real risks. You might see testimonials asserting that sodium bicarbonate can eradicate chronic diseases overnight, or that it will miraculously keep you looking young. It's no surprise this type of content gains traction. In times of uncertainty, quick fixes sound appealing. Yet reputable health experts consistently highlight the importance of well-rounded approaches instead of leaning on a single ingredient. Some online sources fail to mention that for older adults especially, abrupt changes in body chemistry can be much more dangerous. Certain unverified claims suggest using baking soda daily without any caution, ignoring the possibility of kidney strain, interactions with prescribed medications, and other hidden pitfalls. Critical thinking becomes crucial when confronted with such headlines. Instead of being swayed by hype, consult with specialists who understand your unique medical history. That extra step spares you from the false promises and one-size-fits-all solutions that flood social media and late-night talk shows. In a world where sensational stories abound, using common sense and verified facts remains the wisest approach. Effects on the nervous system and the heart. Sodium bicarbonate influences how nerves transmit signals and how the heart maintains its regular rhythm. In small medically supervised doses, it can support certain treatments. But problems arise when individuals self-administer large quantities, often daily, hoping to enhance energy or reduce heartburn. When your blood's pH level shifts too much toward alkalinity, crucial electrolytes, such as sodium, potassium, and calcium, can fluctuate. These minerals are fundamental for stable nerve function and heart contractions. Older adults in particular may be more sensitive to such imbalances because the body's recovery mechanisms aren't as robust as they once were. In extreme cases, arrhythmias or sporadic palpitations might occur, creating anxiety and further stress on the heart. If the nervous system is compromised, you might notice tremors, tingling sensations, or difficulties focusing. These symptoms can accumulate gradually, leaving you mystified about their true cause until it's too late. A lighthearted perspective might say, better to stay calm than to fizz over, and there's some wisdom in that. Choosing moderation and expert guidance can help preserve your heartbeat's steady tune while keeping mental alertness intact. Ultimately, the body thrives on balance, so be wary of any over-the-top claims promising that more baking soda is always better. Sodium bicarbonate can be an effective tool when prescribed in measured doses by a qualified healthcare professional. For instance, some individuals with specific kidney conditions might benefit under the right circumstances, and occasional use for stomach relief is widely recognized. The real trouble emerges when people latch onto half-truths or rely on random online tips that ignore personal medical history. Following generic advice such as adding a spoonful to every glass of water or drinking it repeatedly throughout the day fosters a ticking time bomb of potential pH disruption and electrolyte imbalances. By contrast, the correct use respects individual factors like age, weight, and any pre-existing conditions. A healthcare provider might suggest slow and careful adjustments or periodic monitoring through blood tests, ensuring no harmful side effects arise. Throwing caution to the wind can result in a cascade of complications, from heartburn rebounds to spikes in blood pressure. While it's tempting to assume that a natural substance won't hurt you, remember that even water can become dangerous if overconsumed. Striking a sensible balance keeps your body operating smoothly and helps avoid the setbacks that come from misguided self-experimentation. Interactions with medications. When sodium bicarbonate meets certain prescription drugs, the results can be unpredictable. Some medications require a precise acidic environment in the stomach to dissolve and be absorbed properly. Flooding the system with baking soda can alter this acidity, either neutralizing essential reactions or accelerating unwanted ones. Blood pressure medications, antibiotics, and even pain relievers may behave differently when combined with excessive bicarbonate. Older adults often take multiple prescriptions, which makes the risk of unforeseen clashes even higher. Additionally, altering your stomach's pH could change how quickly active ingredients reach the bloodstream, potentially leading to side effects or reduced effectiveness. If you're already managing chronic conditions, this can complicate treatment and frustrate both patients and doctors alike. Juggling multiple pills can be challenging enough, so adding an unregulated dose of baking soda into the mix just raises the stakes. A whimsical take might be, mixing too many potions can turn the recipe sour, and that fits perfectly here. Before you decide to add baking soda to your daily regimen, consult a professional who understands these interactions. It's always better to ask a few extra questions than to jeopardize the benefits of essential medications. Effects on the digestive system. Overdoing sodium bicarbonate can produce a roller coaster effect on your digestive tract. Initially, you might feel relief if you're prone to heartburn, as baking soda neutralizes some of the stomach acid causing discomfort. Yet relying on this approach daily can backfire. The stomach naturally produces acid for a reason. It helps break down food, initiates nutrient absorption, and defends against pathogens. If you suppress too much acid over an extended period, your body may respond by producing even more acid to compensate, leading to a rebound effect. This pattern can aggravate chronic heartburn rather than ease it. Furthermore, imbalances in stomach acidity can disrupt the friendly bacteria in your gut, leaving you more susceptible to digestive complaints like bloating, gas, or irregularity. Some individuals also experience belching or a sense of fullness that diminishes appetite. While a single instance of baking soda for indigestion typically isn't harmful, repeatedly leaning on it erodes the body's natural defenses. Instead of a quick fix, seeking a well-rounded solution, perhaps adjusting meal portions, timing, or type of foods, often yields more lasting benefits. Moderation remains pivotal to keeping your gut healthy, active, and prepared to process nutrients effectively. Overuse dosages. Determining the right dose of baking soda is not a simple, one-size-fits-all affair. Many factors come into play, including individual health status, age, and the presence of other conditions like high blood pressure or kidney dysfunction. Despite these variables, some people indiscriminately gulp down large quantities, perhaps convinced that if a little is helpful, more must be superior. Over time, excessive dosing can push your body's acid-base balance into a dangerous zone. For older adults, this risk is heightened because your organs may not bounce back from stressors as quickly as they once did. Symptoms such as persistent nausea, irritability, or swelling in the limbs can creep up, going unnoticed until they become more severe. Studies focusing on electrolyte disturbances show that monitoring sodium intake is particularly crucial, as excessive salt poses threats to cardiovascular well-being. If you find yourself adding a heaping spoonful day after day, it might be time to ask whether you're risking more harm than good. Seeking personalized guidance is far more reliable than following generic tips you see online. By paying attention to your unique physiology, you avoid the pitfalls of overuse and keep your health in a safer, happier place. Mechanism of action on acidity. Sodium bicarbonate's main function lies in its ability to neutralize acids, creating water and carbon dioxide in the process. This chemical dance can be incredibly useful when managed carefully, such as easing temporary discomfort from acid reflux. However, older bodies depend on maintaining a particular range of stomach acidity to activate digestive enzymes and break down food efficiently. Sudden, large doses of baking soda can override these mechanisms, prompting your digestive system to produce even more acid, as we mentioned earlier. On top of that, once baking soda slips into the bloodstream, the kidneys and lungs must coordinate to recalibrate your body's pH. Excess use can tax these organs, potentially leading to vulnerabilities like kidney stones or breathing difficulties during stress or exercise. There's a fine line between short-term acid relief and disrupting essential functions. Whenever you read about using baking soda to combat acidity, remember that moderation allows the body to keep its own finely tuned system in harmony. If you sense the need for extra help, discussing options with a healthcare provider ensures that solutions do not undermine the natural processes your body relies on every day. Effect on the absorption of minerals and vitamins. When you change the acidity in your stomach and intestines, you also affect how well you absorb critical nutrients. Certain minerals like iron and calcium rely on acidic conditions to become soluble enough for the body to use. If you rely too much on baking soda to balance acid, you might inadvertently reduce the availability of these nutrients, leading to deficiencies over time. Older adults especially can feel the impact of slight shifts in nutrient absorption, as bones and muscles require consistent replenishment to remain strong. For instance, if you are already struggling with mild anemia or thinning bones, excessive baking soda could compound those issues. Some studies hint that persistent alkalization of the stomach can alter gut flora, further complicating nutrient uptake. Don't be surprised if adding too much sodium bicarbonate to your daily routine leads to unexpected fatigue, weaker nails, or hair that lacks its usual luster. The body depends on a myriad of vitamins and minerals to keep you feeling vibrant, so any obstacle in that chain reaction is best avoided. Strive for a balanced approach that allows for normal stomach function while offering targeted nutritional support, rather than resorting to extreme alkaline measures. Interactions with dietary supplements and herbal medicines. From herbal teas to specialized nutritional capsules, many older adults incorporate these supplements into their routines to maintain vitality. However, when baking soda is added, it can alter how these products are broken down and absorbed. Some herbal medicines depend on specific pH levels to release active compounds, which baking soda might neutralize too quickly or too aggressively. Imagine preparing a pot of herbal tea and then pouring it through a filter that strips away its key ingredients. That's similar to what can happen in your stomach if the acidity is not right. Moreover, certain natural remedies contain compounds that work synergistically with your body's enzymes, requiring a careful balance to unleash their full benefit. Excessive sodium bicarbonate can disrupt that harmony, potentially wasting both money and effort if the supplements never reach their intended targets. In serious cases, the mismatch can lead to unexpected side effects like abdominal discomfort or abnormal lab results during medical checkups. Instead of mixing random health strategies, it pays to verify with qualified practitioners who understand the nuances of herbal and conventional medications. That way, you preserve the potency of supplements and steer clear of counterproductive reactions. Effect on hormonal balance in the body. Hormones orchestrate everything from your mood and energy levels to metabolism and bone health. They depend on stable chemical environments to function optimally. Excessive baking soda consumption can indirectly skew these fine-tuned processes by causing repetitive shifts in blood chemistry. For example, a consistently alkaline setting might influence the behavior of hormones involved in digestion or fluid regulation. While research in this exact area is still emerging, some experts point out that chronic disruptions in pH may trigger stress responses, prompting certain glands to ramp up or scale back hormone production. For older adults, even minor hormonal shifts can have noticeable impacts, such as sudden changes in sleep patterns or unusual weight fluctuations. A lighthearted way to think of it: if your body is a grand orchestra, hormones are the conductors, and baking soda might be an overenthusiastic percussionist banging the drum off beat. Balancing your internal environment remains key to feeling grounded, alert, and resilient. Before making baking soda a daily ritual, consider how it might nudge your hormone levels out of alignment. It's far easier to prevent such imbalances than to correct them once they've become entrenched. Safe usage recommendations. Maintaining a sensible perspective is the cornerstone of safe baking soda use. A tiny pinch added to a glass of water might offer quick relief for the occasional bout of heartburn, but you don't want to turn it into a habit without guidance. Always check with a healthcare professional, especially if you have kidney concerns, hypertension, or a record of electrolyte imbalances. They can assess the appropriate dose, if any, that aligns with your specific health conditions and medications. Pay attention to how you feel. If you notice swollen ankles, frequent cramps, or unexplained fatigue, it could be time to step back. Keeping a small journal to track symptoms and fluid intake can be surprisingly helpful. It's also wise to monitor your overall sodium consumption, as baking soda adds significantly more salt to your daily totals. In a lighter vein, you might say, "A dash is fine, but a tidal wave is a problem." That bit of humor underscores an essential message. More is not always better. By heeding professional advice, staying observant, and balancing your diet, you can reduce the likelihood of serious complications and continue to enjoy any legitimate benefits baking soda might offer. Alternative and safe methods. Pursuing a balanced approach doesn't mean you have to ignore the underlying reasons that led you to try baking soda in the first place. If your aim is mild heartburn relief, for example, consider herbal teas like chamomile or ginger, which soothe the digestive tract without severely altering pH. For overall alkalinity, some people find that switching to a diet abundant in leafy greens and mineral-rich fruits gently supports the body's natural balance. Instead of aggressively neutralizing stomach acid, you might focus on smaller, more frequent meals that don't overload the digestive system. A few studies have even shown that mindfulness practices, such as moderate yoga or Tai Chi, can help manage the stress that sometimes exacerbates acid issues. Older adults might also explore low-impact exercise routines that aid circulation and overall metabolism, giving you a more holistic advantage. Anyone curious about advanced techniques can consider speaking with an integrative health specialist, who can recommend personalized approaches such as specific probiotics or targeted mineral supplementation. These alternatives can often deliver the same sense of well-being as baking soda, minus the potential complications. Embracing these safer, scientifically grounded options keeps you on a steady course for sustained health. Dear friend, always keep in mind that this isn't tailored medical advice. Please consult your doctor for any personal health concerns. If you found these insights valuable, share them with your loved ones on WhatsApp. And don't forget to watch the video on your screen. It's sure to spark your curiosity and inspire you.